It was widely reported last month that a third of COVID-19 deaths in England were linked to diabetes. Well, this week is Diabetes Week, and we're joined now by Dr. Sarah Brewer, a GP and representative for Curelin, a herbal supplement for people with type 2 diabetes. Dr. Brewer, thank you very much for joining us. Why are people with diabetes at an increased risk of dying from COVID-19?
The reason why some people with diabetes have worse outcomes with COVID-19 and more serious complications isn't fully understood. It's thought to relate to increased levels of inflammation in the body as a result of the underlying metabolic abnormalities. It's also thought that having poorly controlled diabetes, you've got raised glucose levels, might suppress your immune system against respiratory infections. It also leaves you more prone to bacterial pneumonia as a complication of a viral infection. Another possibility is that, particularly for people with type 2 diabetes, this is associated with obesity. Obesity in itself increases levels of inflammation in the body, so you have a double whammy, if you like, as risk factors towards more serious symptoms.
Now, diabetes wasn't on the shielding list, but people with the condition are obviously at an increased risk. So should people with diabetes be shielding, in your opinion?
It's only recently that we've looked back on the number of people that were admitted to intensive care, for example. Research coming out of China, looking at thousands of people there who were affected, show that those with diabetes were twice as likely to need intensive care. Research within the UK itself shows that people with type 1 diabetes were 3.5 times more likely to have severe outcomes. So it perhaps wasn't recognised initially. Certainly, we were recommending that anyone with long-term health conditions should take extra care.
Of course, these are worrying statistics that we're talking about here. So what steps can people be taking to improve their chances, essentially?
Well, I think it's important not to be scared. The first thing to say is that many people with diabetes, like people who don't have diabetes, will have very mild symptoms if they become infected with COVID-19. The other thing, of course, is that you're no more likely to catch COVID-19 if you have diabetes than if you don't. The problems arise if you're one of the people who seem to be particularly susceptible to complications, and we don't know who those people are. So it's important to follow all the advice, to maintain blood sugar levels that are as normal as possible. That does seem to improve outcomes. And if you are worried, talk to your doctor.
Now, we mentioned right at the top of the interview that you are a representative for Curelin, which is a herbal supplement for people with type 2 diabetes. So what does that do?
Curelin is an Ayurvedic herbal supplement. It contains 10 herbs, some of which you might have heard of, like turmeric and fenugreek, and others which are less well known in the West, although they're widely used in India to treat diabetes. If you have type 2 diabetes and you are on diet or lifestyle management, then it's an ideal supplement to take if you need some extra help controlling your blood glucose levels. The herbs that are in there work together in a synergistic way. They have effects on the liver to reduce the amount of extra glucose that some people with diabetes make. The herbs also increase release of insulin from the pancreas. It improves the way that your cells, your muscle and fat cells, respond to insulin. One of the herbs in it, called gymnema, has an effect to suppress your craving for sugary foods. It can suppress appetite, and overall it helps people to control their blood sugars better if they have type 2 diabetes and are using diet and lifestyle measures.
Okay, Dr. Brewer, thank you very much for your time today.